This podcast is for informational and educational purposes only and is not to be considered medical advice for any particular patient. Clinicians must rely on their own informed clinical judgments when making recommendations for their patients. Patients in need of medical advice should consult their personal healthcare provider. From UPMC Children's Hospital of Pittsburgh, welcome to That's Pediatrics.
I'm Brian Martin. I'm Vice President of Medical Affairs here at Children's.
And I'm Carolyn Coyne. I'm a scientist in the Division of Pediatric Infectious Diseases.
And today we'd like to welcome Dr. Dean Yimlamai. He is an assistant professor with the University of Pittsburgh School of Medicine and also a Mellon Scholar here at Children's with the Richard King Mellon Institute for Pediatric Research. His research includes Hippo signaling in liver growth and oncogenesis and the role of immune cells in hepatocyte activation.
Hi, thanks for having me today.
Thanks for joining us, Dean.
Oh, no problem.
So why don't we start with a little bit of background? Tell us a little bit sort of about your training, what brought you here to Pittsburgh, and then maybe we can talk a little bit about your research.
I was thinking actually recently about what brought me here, and I think I've always been a developmental biologist, a person who's just interested in how things grow. And it's almost 20 years ago that I worked with a person who was an MD PhD. So today I'm an MD PhD as well. And I took a little bit of time off after college to kind of figure out what I wanted to do. And I worked with a geneticist who studied Down syndrome and Williams syndrome. And I would say that I went through college enjoying my classes and doing things like biochemistry, and I was a biochemistry major, but I didn't have a great plan on how I was going to integrate these things into a career. And so I worked with a woman, her name is Julie Kornberg. She's at the University of Utah now. But at the time I lived in LA, and she had a really kind of amazing life that I thought. She lived in Beverly Hills, which I still wish I could do. But she had the ability to both see patients, usually once or twice a week, who had Williams syndrome and Down syndrome, and also had a lab where she was trying to understand what causes the things that we know as Down syndrome or Williams syndrome. And in Down syndrome, those are things people are familiar with, things like their height or heart disease, but even things like leukemia that happens much more frequently in patients with Down syndrome. And I would say that with the patients with Williams syndrome, they are both quite delayed in their ability to relate to people, and sometimes quite loquacious. I mean, I think this is one of, if one ever gets to meet a patient with Williams syndrome, one of the things that really drives people's interest in them is the first impression is that they're quite delayed, but after you get to know them, they have some really extraordinary abilities, and the things that are always written about with such patients are their ability to sing, their ability to actually remember musical phrases, even though they may have a really difficult time with spontaneous conversation. And sort of understanding what the genetic basis was, and also having basically a workshop. I mean, I think that's, even today, I have a lab that I think was a workshop on trying to understand, how do you build these things? And in her interest, it was, how do you build a brain or, the blood system? For me, I am really interested today in how do you build organs, and specifically the liver. And that's kind of where I got started. And then, I spent a few years with her, and then I went and got an MD PhD in Boston at Tufts, and trained in pediatrics. And again, that's another thing that I sort of came back to. I explored many, many things, development of the heart, blood development, but I really wanted to understand kids and how do kids grow, and what makes them grow normally, and obviously what's the genetic basis of some of the things that are real problems in peds.
So after completion of medical school and your PhD, you did a GI fellowship thing, correct?
I did.
After pediatrics. What sort of led you in that direction? Was this a sort of hepatology kind of?
It was not, actually. I mean, I think most of the people who are actually really attracted to doing gastroenterology GI are interested in the intestine, so stomach, how do you absorb, mouth. And I would tell you that that's clinically mostly what I do. From a research perspective, the liver is connected and is part of the GI tract, was something I almost fell into because of, to some extent, just what was available when I was looking for a research project. But it is still a very connected system to me. I mean, obviously, we need all of these parts to digest, and it still gets at the sort of basic questions that I'm interested in, which is how do you build a normally functioning system, and then when there's problems, where does it start? So
I wonder if you could expand on that a little bit, because I agree with you that the liver is often overlooked when we think about the GI system. And so maybe tell us a little bit about what the liver does and during digestion, and why do we consider it part of the GI tract?
Yeah, so it grows as what we call an outpouching, actually, of the small intestine. It makes a lot of the enzymes that we use to digest our food. It also processes a lot of the blood, and it's, I think, underappreciated. I think, see patients, we know when people are sick with liver disease because they become jaundiced, that you can see them on the street, they're yellow, you can see it in their eyes, you can see it in their face, you can see it in how they move. And I have to say that I was aware, but I didn't appreciate these things when I started out. And it is one of the parts of metabolism of our growth and development that's actually really underappreciated. I mean, I think when we talk, for example, about diabetes, we think a lot about the pancreas. But the major place where we metabolize sugar is in the liver. And one of the things that really has gotten me, again, I started in this field almost 10 years ago, and I had a sort of minimal interest. I shouldn't let my mentors hear this, but it's a really growing interest and appreciation. And I think that's one of the things that drives me today. So about just the liver and things like metabolism, there's a lot of obesity in the world. We know that in the U.S., more than half of children are obese. A lot of that fat goes in the liver, and it causes metabolic problems. And again, we think of fat in the skin, but we know that too much fat in the liver is toxic, and that leads to some of the things like diabetes. The inability, there's too much fat, the fat is toxic, and we can't metabolize things like sugar. And then, unfortunately, the things that really take people are not liver problems, but things like heart attack and those issues.
I'd like to segue a little bit over into liver repair and recovery from injury and cell signaling mechanisms and that kind of stuff. Can you expand on how you sort of ended up going down? You took it all the way back to developmental biology. How did you sort of segue over into this, the current portion of your career in terms of working with this Hippo Signaling Pathway?
Sure.
Which I will admit I had to look up on Google.
So, Hippo is named for hippopotamus, actually, because it was discovered in Drosophila, which is a small fruit fly. People have done many what we call genetic screens, and these are ways of looking for genes that are important in development. And so one of the mutants in the Hippo pathway, the first one was called Hippo because it was quite large and had sort of a rough skin, which is what hippos have. So many of the things that we do in what we call model systems, things like Drosophila, are replicated in people. And we use model systems as ways of discovering new tools so that really we can change human health. Ultimately, the NIH gives money to to make basic discoveries so that then we can translate them. And how I got into this pathway was I just like many things, I was suggested by a mentor to go to a seminar that there was a young guy who had some really interesting work, but he had a really small lab, and he was giving a seminar, and he was working on the Hippo pathway, and my mentor's name was Fernando Camargo. He was a young investigator, and this was, at least from the perspective of translating these things in fruit fly into humans, was really early days. There had only been one or two papers looking at what different components of this pathway did in mice, and there's more and more work nowadays. And there was one or two papers just saying that the things that we saw in fruit flies and mice was replicated in people. And he put up these slides of really what we call dramatic phenotypes. And if you ever get the chance to work with Fernando or someone like him, I mean, these are the words he's not a person who likes 10% or 20%, even if it's significant. I mean, he's a person who we're always having to dial back, and because the words of humongous and massive are always sort of rolling out out of his mouth. But at the same time, it was really clear from the things he was showing, and although he was young and he only had 3 or 4 people working with him at the time, that this was something that was really impactful. And I think, as we get back to how I started, I was always looking for things that could have an impact that, there's not too many people doing, but obviously, if you show the right picture, this is something people should work on. And so the work that I do today still focuses on the Hippo pathway, but in some of those diseases that I talked about, what happens in fatty liver? Is the Hippo pathway activated? And the short answer is yes. Do you get cancer and from too big a liver? The answer is yes. Is it through this pathway? Yes. And if we inhibit, key portions of the pathway, can we reduce incidence of cancer? I would tell you the answer is yes in mice, and we're still waiting to figure out if that's true in people, but that's how we sort of establish where we're going to start. And obviously this is the kind of arguments that we make when we go to places like the NIH or foundations to say that we're doing important things that affect a lot of people, and why we should study these things with funny names like Hippo or...
Well, and I'm wondering if you can tell us a little bit about liver regeneration. Is
Sure.
there something unique about the liver, different about the liver? People, I think, have this concept that you can take someone's liver and cut it in half and it's going to grow back and be completely normal.
Yeah.
And so can you tell us a little bit about that?
Sure. So people are always, I think, familiar with stories, even from mythology, this idea of Prometheus, who was a god who was chained to a rock and as punishment had his liver chewed out and then overnight regenerated his liver. So we can do that actually in mice as well as in people. In mice, they actually regenerate their liver. If you take out half their liver, they'll have an equivalent liver in 7 days. And you can do the same thing in people. It takes about a month, so it's a little bit slower. But that's one of the things that allows us to do liver transplants, actually living donor liver transplants. And we're at UPMC, and just to plug why I'm even at UPMC, it's because this is one of the first transplantation places where transplantation occurred. Tom Starzl was a pioneer. He's created, even though he's not with us any longer, he created a culture where people want to understand, improve transplantation. And this is one of the leading places where living donor liver transplantation occurs. And that's where you can take a piece of an adult liver and transplant it to someone else. Usually it's to someone smaller, like kids. But usually what they do is take a small triangle of the left lobe of the liver, and you're able to give it to kids who might have some kind of severe liver disease. So there's a lot of that kind of work going on here, and there's a lot of people trying to understand different kinds of regeneration. So it's a great place to be, especially for someone like me who's I still feel like I'm just getting into the field. So
I still feel that way about my field, so I don't know that ever goes away.
Probably not.
That's just about everybody. Yeah, I'd love for you to see, I mean, you just mentioned this sort of interdisciplinary collaboration opportunities here at UPMC. Is there any particular area which really excites you about, you mentioned the work that Tom Starzl and the rest of the Transplant Network does here. Are there any other specific labs or other people that you could see as being influential in terms of where the direction that your research is going to go?
Well, gosh, I'll say that I'm involved in the Pittsburgh Liver Center, which is actually a new center that was created just 2 years ago in collaboration with UPMC and Pittsburgh. So Paul Monga heads that center. He is a professor of pathology. I really do consider him a mentor, having moved from Boston here. They are really interested in not only understanding sort of some of these transplant things that there's a Starzl Institute, which is devoted specifically to liver transplantation. But the Pittsburgh Liver Center is sort of a more expansive group of investigators. And I think Paul Manga has been great. Gavin Artiel, he's a recent, very senior recruit. He came from the University of Louisville. And George Michaelopoulos, who's the chair of pathology, has also been a great mentor to me. And these are all people who are actually quite influential in the field that I work in. They have made some fundamental discoveries in what starts and stops this liver regeneration process that I touched on, but also what might be the key signaling pathways that lead to cancer development. Because on the one hand, it's important to start regeneration to make a new organ, but obviously if it goes on too long, that leads to things like cancer, and that's another thing that we want to understand a lot better. Liver cancer has, unfortunately, really terrible outcomes. If you catch it early, you can cure it by surgery, but unfortunately, at 5 years, 80% of people won't be with us because the chemotherapy, there's really only one drug out there that's effective, and that usually only gives you a few months to live. And that's not what we expect for most of our cures, especially in something like pediatrics. And unfortunately, the numbers for pediatric liver tumors is slightly, but not much better than adults. So
can you tell us a little bit, I know some of your work looks at the immune cells in the liver and how that might impact sort of liver function and development. And the liver is not often thought of something as an immune organ. And so could you tell us a little bit about the liver as it functions in immunity?
Sure. So the first place where nutrients are absorbed that sees the body is the liver. It makes sense, actually, if you think about it, to have immune cells to be able to react and filter if necessary, detoxify these things. So it forms a number of roles. I mean, one that we think about all the time was just filtering, but also how do you respond to infections, whether that's a diarrheal infection, whether that's a hepatitis, whether that's an infection from your cruise trip. I'm really interested actually in how regeneration occurs, and then how do you recruit immune cells to that? I mean, it's important to bring in immune cells when you're regenerating to clean up dead cells, obviously to clean up things like bacteria. How do you reform these filters to keep what's inside and what should stay out, and to keep those protective barriers? So we're really interested right now with respect to regeneration is what's the coordination aspect that goes on. And then in things like cancer, we know that when you have excessive regeneration, that the immune cells actually can come in and reduce those cancer cells. And one of the really big things in cancer therapy right now is how to reactivate the immune system. And so we know that the liver is a great model to understand that. How is it happening normally? And then, when you develop cancer, how do you evade it? So we know that the Hippo pathway is doing something on that side.
And thinking about the liver throughout life, are there differences between kids and adults in terms of how the liver functions from any sort of immune aspects or function aspects?
Well, we know that all of our cells age, and they have the ability to regenerate more slowly. One of the good things about the liver is that hepatocytes, the red cells of the liver, probably only divide once or twice a year on average. That's about their lifespan. It's about half a year. So as compared to other cell types, they don't have to regenerate that often. Mm-hmm. But we know that when you're exposed to toxins, alcohol, for example, that you have to accelerate that regeneration process. And that leads to some of the problems that we talked about, some of the metabolic problems, some of the issues with cancer. And obviously, my work sort of impacts on that.
So fortunately, the habits of children
differ
from
Sure.
in terms of the potential badness, if you will,
Exactly.
than from the adult population.
Well, I mean, I think one of the things that we're really, although kids don't drink, unfortunately, we're seeing a lot of obesity, and we know that excess fat is a toxin. Mm-hmm. We know there are toxic lipids, and we know that it causes excessive regeneration. We see clearly a lot of immune infiltration, which in itself can be an inciting stress that eventually leads to things like cancer. So as we think about obesity, how do we help children? We know that right now, transplantation for obesity is the third leading cause of transplantation. It's projected from obesity to be the number one reason for transplantation in about 15 to 20 years. So it's an issue. It's an important issue. I mean, I think we think about it, lots of metabolic things. We think about the cardiovascular issues, but this is another place where it clearly is going to impact us. It's going to impact the healthcare system, and it's something we haven't really seen. So,
well, thank you very much for joining us, Dean.
Well, thanks for having me.
You can find other episodes of That's Pediatrics on iTunes, Google Play Music, and YouTube. Be sure to subscribe to keep up with new content. Leave a review and tell us what other topics you'd like our experts to cover. Thank you for listening.
Thank you.